Spondylolysis is a crack or stress fracture in one of the vertebrae. It most often occurs in children and adolescents who participate in sports that involve repeated stress on the lower back, for example gymnastics, football and also weightlifting. The fracture develops through the pars interarticularis, which is a small, thin portion of the vertebra that connects the upper and lower facet joints. The most common fracture site is the fifth vertebra of the lumbar spine, and it can occur on one or both sides of the bone. Now, spondylolisthesis is when the fracture is left alone and causes the vertebra to weaken, and so much that it can't maintain the proper position in the spine. As a result, the fractured pars interarticularis separates, allowing the injured vertebra to shift or slip forward onto the vertebra directly below it. This often occurs in periods of rapid growth during adolescent growth spurts. This illustration here shows the pars interarticularis in a normal spine. Then in the middle image we see spondylolysis occurs when there is a fracture of the pars interarticularis, and finally on the right, spondylolisthesis occurs when the vertebrae shifts forward due to the instability from the pars fracture. Both of these are more likely to occur in young people who participate in sports that require hyperextension of the lumbar spine. For example, as mentioned previously, gymnastics, football and weightlifting. And over time this overuse will weaken the pars interarticularis and lead to these fractures and also slippage of the vertebra. Symptoms that occur with fractures can be similar to that of muscle strains. They can also radiate to the buttocks and the back of the thighs, and they would worsen with activity and be better with rest. In addition, if there is slippage of the vertebra itself, back stiffness is common, and tight hamstrings may also occur. X-rays can be used to view stress fractures in the vertebra and also view the alignment of the vertebra itself. In this X-ray you can see an L5 fracture of the pars interarticularis, and it has slipped forward onto the vertebra below it, suggesting spondylolisthesis. Treatment is commonly non-surgical in nature, and this includes rest, avoiding the sports or activities that may have caused this injury, non-steroidal anti-inflammatory drugs such as ibuprofen, which can help with swelling and also pain. Physical therapy can be used to improve flexibility, and bracing can limit the movement in the spine to aid in healing. Surgery may be indicated for spondylolisthesis if a person has severe or high-grade slippage of the vertebra, and spinal fusion would be the procedure of choice in these cases. Thanks for watching, and I hope you found this useful.